Okay, so continuing a bit with the lungs and the pleura, um, I want to understand a bit of the anatomy of the thorax, the thoracic cage, the thoracic cavity. So we have three cavities, the left and right pulmonary cavity and the mediastinum. And then in the cage, tell us what we have, like the sternum, the ribs, etc., and the thorax, thoracic inlet, outlet, etc.
All right, let's dive into the lungs, pleura, and the thoracic cavity, keeping it clear and concise. The thoracic cavity, or chest cavity, is the space inside the rib cage, protected by the thoracic cage, bones, and muscles. It's divided into three main parts: the left and right pulmonary cavities, housing the lungs, and the mediastinum, central area with the heart, trachea, esophagus, and major vessels. Thoracic cage structure: sternum, flat bone at the front, breastbone, connecting ribs via cartilage. Ribs, 12 pairs. True ribs, 1-7, directly connect to sternum. False ribs, 8-10, indirectly connect. Floating ribs, 11-12, no sternum connection. They form the cage's sides. Vertebrae, thoracic spine, T1, T12 at the back, anchoring ribs. Muscles, intercostals, between ribs, aid breathing. Diaphragm below drives inhalation. Thoracic cavity, left-right pulmonary cavities. Each contains a lung, surrounded by pleura, double-layered membrane. Visceral pleura covers the lung. Parietal
Okay,
pleura, lung.
that makes sense. Okay, can you explain to us the difference between SpO2 and SaO2?
Beleza, vamos lá.
Can you
Switching
speak in
to
English, please? Yeah.
My bad, all good. SpO2 is the oxygen saturation measured non-invasively by a pulse oximeter, estimating the percentage of hemoglobin carrying oxygen in peripheral blood, usually 95-100% in healthy folks. SaO2 is the arterial oxygen saturation, measured directly via arterial blood gas, ABG, from an artery, giving a precise percentage of oxygen-bound hemoglobin in arterial blood. Also, 95-100% normally. SaO2
Wait,
is...
so one is in the artery and the other one is what?
All right, let's clear it up. SaO2 is measured directly from arterial blood via arterial blood gas test, showing the exact percentage of hemoglobin carrying oxygen in arteries. SaO2 is measured non-invasively with a pulse oximeter, usually on a finger, estimating oxygen saturation in peripheral blood, capillaries. SaO2 is precise but invasive. SaO2 is easy but less accurate in certain conditions like low blood flow. Got it?
No, I haven't got it.
No problem. Let's simplify. SaO2 is the oxygen level in arterial blood. Check by pulling blood from an artery with a needle. Super accurate. SaO2 is the oxygen level guessed by a clip-on pulse
Wait,
oximeter
dude.
on your finger.
You're saying
Reading.
essay and you're saying again essay. Is it the way you're speaking? Let me check. Okay. So SaO2 is the ABG. SpO2 is the quick one. Okay, yeah,
My
that
bad.
makes
If
sense.
I'm
That
tripping
makes
you up.
sense. No, that makes sense. That makes sense. Okay, so guys, SaO2 is for arterial blood gases. SpO2 is the pulse oximeter one. Okay. Let's talk a bit about respiratory failure and about compensation.
Nice. You go.
Shall we?
Perfect. Let's tackle respiratory failure and compensation.
And
Keeping
remember,
it tight.
remember, answer us with the least amount of words while getting. Yeah, answer us with the least amount of words while also getting your point across.
Got it. Minimal words, max clarity. Respiratory failure. Lungs fail to oxygenate blood. Low PaO2 or remove CO2. High PaCO2. Type 1. Low oxygen, normal CO2. e.g., pneumonia. Type 2, low oxygen, high CO2, e.g., COPD. Compensation, kidneys adjust blood pH. High CO2, acidic, retain bicarbonate to neutralize. Low CO2, alkaline, excrete bicarbonate. Takes hours to days. Respiratory system compensates faster, adjusting breathing rate. Want more on causes or treatment?
I want to ask you about partial pressure in gas atmosphere.
Partial pressure in the atmosphere is the pressure each gas, like oxygen, nitrogen, contributes to the total air pressure. At sea level, total pressure is 760 millimeters a merc. Oxygen's 21%, so its partial pressure, PO2, is 0.21 plus 760 equals 0.21 times 760 equals 0.21 times 760. In lungs, PO2 drops to 100 millimeters due to water vapor and mixing. Drives oxygen into blood. PaO2, 95 to 100 millimeters a merc. Utoko 75, 100 millimeters a merc. In lungs, PO2 drops to 100.100. CO2 works similarly. Lower partial pressure, 40 millimeters per hour. In blood, key for gas exchange. Want more on how this ties to respiratory failure?
I don't get it. I don't get this partial pressure. So it's basically, sorry guys, there's an airplane for whatever reason. Yeah, so it's the partial pressure of oxygen in the atmosphere. What about, and pressure in liquid is more? Or
No
less?
worries about the airplane. Let's clear up partial pressure. Partial pressure is the pressure of one gas, like oxygen, in a mix, like air. In the atmosphere, air pressure is 760 millimeters of mercury at sea level. Oxygen, 21% of air, has a partial pressure, PO2, of 0.21 times 760 equals 0.1000. In lungs, PO2 falls to 100.100 due to humidity and mixing with CO2. In liquid, like blood, partial pressure, PaO2, is the dissolved oxygen's pressure, 75.10 millimeters in arteries, driving oxygen from lungs to blood. Not more pressure in liquid, just different. It reflects how much oxygen is available to bind hemoglobin. Partial pressure gradients make gas move high PO2 in lungs to lower PaO2 in blood. Make sense? Or want an example?
No, that makes sense. Why don't we talk a bit about dyspnea and narcosis too?
All right, I think you mean nitrogen narcosis, not fear narcosis.
No, I
Since
said
we're on
in.
gases and partial pressure, often tied to diving. Nitrogen narcosis happens when divers breathe high pressure air deep underwater. Nitrogen's partial pressure rises with depth, e.g., at 30 meters, pressure's 4 atm. My bad. Let's try again. Assuming you meant nitrogen narcosis, common diving topic, it's when deep divers inhale air under high pressure, boosting nitrogen's partial pressure. At depth, e.g., 30 meters, 4 atm, PN2 spikes, dissolving more nitrogen in blood and brain, causing euphoria, confusion, or impaired judgment like being
Okay.
drunk.
Let's talk a bit about compensatory breathing too. So we have, let's say, high CO2 in the brain. We want to compensate, we want to breathe faster. We have a higher respiratory rate, hyperventilation. And then, what's going on after that?
High CO2 in the brain, hypercapnia, triggers compensatory breathing. Chemoreceptors in the medulla and carotid aortic bodies sense high CO2 or low pH. This signals faster, deeper breathing, hyperventilation, to blow off CO2, raising blood pH. Respiratory rate increases, tidal volume rises. After, CO2 drops, pH normalizes, breathing slows. If overdone, low CO2, hypocapnia, can cause alkalosis, leading to dizziness or tingling. Kidneys may later adjust bicarbonate to fine-tune pH, but breathing's the fast fix. Want more on what messes this up, like in COPD?
Okay, let me ask you a bit about. Sorry for the noise, guys. If it continues, I'll go inside. So, let me ask you about fractional inspired oxygen and fractional inspired carbon dioxide. What does this mean?
All right, let's dive into fractional inspired oxygen, I5O2, and fractional inspired carbon dioxide, FiCO2. I5O2 is the percentage of oxygen in the air you breathe. Room air is 21% oxygen, so I5O2 equals 0.21. In medical settings, like on a ventilator or oxygen mask, I5O2 can be increased, e.g., 0.4 or 40% to boost oxygen delivery. I5CO2 is the percentage of carbon dioxide in inspired air, usually near 0.0% in room air, as CO2 is minimal
So what's the
outside the
difference
body.
of
In
partial and
rebreathing
wait,
scenarios,
wait, dude.
e.g.,
Wait,
faulty
wait, wait,
ventilators,
wait, wait, wait.
I5CO2
Hey,
rises,
hey, hey,
which
hey,
is
hey,
bad,
hey.
increasing blood CO2.
It's not stopping,
Both affect
guys.
partial pressures, e.g.,
Hey, buddy. Remember, keep your answers really short for the next 200 messages. I just wondered, what's the difference between fractional inspired and partial?
fractional inspired FiO2, FiCO2, is the percentage of a gas like oxygen, 91%, in inhaled air. Partial pressure, PO2, PCO2 is that gas's pressure, mHg, in the mix, like 160 millimeters per mHg for oxygen and air. FiO2 drives PO2.
I don't get it, bro. Yeah.